This month is the month of October, and as we know, this month we're celebrating breast cancer awareness. It is being celebrated all over the world, and today in Chapel of Greatness, being today is our Inspiration Sunday, so we just want to use this forum to educate our women more about breast cancer. It is a thing that most women don't take serious, that we think no one of us can get it. In Jesus' mighty name, it won't be our portion, but we just want to be aware of it, that it is something that can be prevented. There's a yearly mammogram that we can go for at certain age. We should not take that for granted. Even if we don't have insurance, there's a way to it. Praise God. Also, if you have friends, families that are going through this disease or has experienced it, we can share the information that we're going to be taught today and let them know. And as we go home today, God will be with us. And I pray that breast cancer or any form of cancer won't be our portion in Chapel of Greatness. Good health will always be our portion. And today we have the honor of Dr. Oluwatoyin Akanbi to educate us on this. Praise the Lord.
Good morning, church. My name is Toyin Akanbi. I am a medical doctor. In my professional life, I take care of adult patients and I specialize in kidney diseases. But today is Inspiration Sunday. It's October, so in honor of Breast Cancer Awareness Month, we'll be trying to learn a little bit more about breast cancer. What do you know about breast cancer? So the next slide, please. So essentially what we'll be learning today, very briefly, will be how common is breast cancer, exactly what it is, what causes it, the risk factors, can it be prevented, tests that you can do to find breast cancer early, and what you can do to treat it in general. We're not going to go too much into the treatment though. Next slide, please. So this is, this could be someone we know, Sister Nike. Let's call her Sister Nike. She's a 39-year-old lady. She's of Nigerian descent. She has really no past medical history. She's very healthy. She has 2 children, Tolu and Yinka. She had Tolu when she was 28, and she had Yinka when she was 30. She breastfed both of them for 4 to 6 months. In a little while, I will see why we're going into some of these details. She breastfed both of them for about 4 to 6 months. She drinks 2 to 3 glasses of wine weekly. So she drinks, but she doesn't drink that much. Her mother has a history of breast cancer. This was diagnosed when her mother was 69, and her mother had to have treatment for breast cancer. She had surgery, chemotherapy, and radiation. Next slide, please. So she's very, she goes to the gym, she's very conscious about her weight, but she's overweight. Her BMI is 29. So one regular Saturday, she is, doing her monthly breast exam, and she feels a lump on her breast. Of course, nobody wants to feel a lump on her breast. She's very scared, and she's alarmed, especially because her mother had breast cancer, so she knows about breast cancer. What does she do next? So can we get the next slide, please? So how common is it? The breast cancer is actually the most common cancer in women in the United States. And it's the second leading cause of cancer-related deaths in the United States. The first cause is lung cancer in women, which is actually going up because women are smoking more. 1 in 8 women, which is a very scary statistic, will actually develop breast cancer. And 1 in 36 women will die from breast cancer. Death rates have actually been going down though. A lot of this has to do with education and early, finding it earlier and preventing spread. Next slide, please. So we hear about cancer. Exactly what is it? Usually the cells in our body multiply and they have a way of regenerating, and the bad cells have a way of being killed off. But cancer is like an abnormal growth in the cells where they continue to duplicate and then they invade other cells and eventually cause death. This, we can skip over this. This is just a quick slide talking about the anatomy of the breast. So exactly what causes breast cancer? The exact cause is not certain. There are things that have been related to it though. But the main thing that is is thought to be implicated is that there are changes in the DNA of the cells. The DNA is the basic makeup of every cell. If there is an abnormality in it, then it's thought that this could eventually cause cancer, and then, we'll see the implications afterward. Next slide, please. The risk factors. So what would really predispose anyone to getting breast cancer? Risk factors are things that can increase or decrease a person's chance of getting a disease. In this case, we're talking about cancer. And for breast cancer, there are many known risk factors, which we can go over. Number one, unfortunately, gender is being a woman. Most commonly is found in women, but it is found in men also. Aging is another risk factor for getting breast cancer. As the population ages, healthcare is better, people are living longer, so we're finding more and more of these cancers occurring. The other risk factors, so I'm actually dividing it up into risk factors that we can do something about and risk factors that cannot be changed. So obviously gender and age, there's nothing that you can do to change that. The option to not aging is dying, which most people, I'm sure, don't want to encounter that early. So genetic risk factors, a lot of people also have cancer because they have a family history of cancer. Not just breast cancer, but having a family history of any kind of cancer will predispose you to having breast cancer also. There are certain women that have some genetic mutations that can be tested for. So usually this testing is done in people who have a very strong family history. It's called BRCA. And this kind of people who turn out to be BRCA1 or BRCA2 positive usually might want to go ahead and prevent getting breast cancer because they are at very high risk. Next slide, please. We already went over the breast cancer family history. So also having a personal history of breast cancer, if you've had cancer in one breast, it's very possible that you could eventually go ahead and have it in the other breast. Next, there are certain abnormalities with the breasts, inflammatory diseases with the breast that can predispose you to having cancer, and women who have had radiation to their chest for whatever reason, in childhood, might have had some kind of malignancy, and they underwent radiation therapy to the breast. They're actually at higher risk of eventually going ahead to get cancer. So now, what are the things that are potentially changeable or modifiable risk factors for cancer, things that we can do something about? Postmenopausal hormone therapy. A lot of women in the process of going through menopause experience hot flashes and a lot of other distressing symptoms, which can be treated with hormone therapy. However, hormone therapy has been shown to increase the risk of developing breast cancer eventually. DES exposure, this is something that is not so common now. In the United States in the 1940s, a lot of women were giving a hormone called diethylstilbestrol, and they were given in their pregnancy. It was supposed to help stabilize the baby, but eventually the mothers and the babies are prone to developing breast cancer because of that exposure. Can we go back to that last slide? So, recent use of hormonal contraceptives. This actually puts you at a slightly higher risk, but very quickly after stopping the contraceptives, the risk actually goes down. But this still comes up on the list. This risk is slightly higher in women who used contraceptives. Next slide, please. Factors that we cannot do anything about. Race. African American, we're black. Black people are at higher risk of getting breast cancer. Women who have dense breast tissue. This is not the same thing as having big breasts. This is something that is seen on a mammogram. It just has to do with the way the tissue makeup of the breast is. women who have more menstrual cycles. So what more menstrual cycles means is that women who start their menstruation early and also continue their menstruation for a very long time. So if you start your menstruation before the age of 12 and then continue your menstrual periods after the age of 55, you're actually at a higher risk of getting breast cancer. Next slide, please. More risk factors, physical activity. If you're more physically active, you're at a lower risk, meaning that being physically active will reduce your risk of getting breast cancer. Also, weight. It comes up, it's implicated in so many diseases. Being overweight will increase your risk of getting breast cancer. Alcohol use. There's a clear linkage between using alcohol, especially the amount of alcohol, with breast cancer, and people who drink more usually have a higher risk. Unfortunately, there are other things that they're put under modifiable risk factors, but I'm not sure how much control you have over this. But not having children or having them later in life, so having children after the age of 30 will put you at a higher risk of having breast cancer. The next thing is not breastfeeding. Women who breastfeed, actually breastfeeding is protective against breast cancer. So not breastfeeding puts you at a higher risk of developing breast cancer. I think we already went over this slide. So what can we do? Can we prevent cancer? There is obviously, there are some people who do everything. They're physically active, they have their children early, they breastfeed, they do everything, but they still get cancer. So there's no sure way to prevent breast cancer, but there are certain things that women can do that can reduce their risk. And even if they do get breast cancer, the hope is that you find it early enough that you can do something about it before it becomes an advanced disease. So number one, obviously, will be get to and stay at a healthy weight. Recommended is being physically active, 150 minutes of moderate exercise weekly and 75 minutes of vigorous exercise for an adult. This is over a course of 1 week. So it's actually better if it's spread out over the week, not trying to get your 150 minutes in one day. That doesn't really give you the same protective benefit. Limit alcohol use. In women, if you have to drink 1 drink per day, and for men, two drinks per day will be the maximum allowed. Obviously, some women also could think about doing things like breastfeeding. If it was something that you were not planning on, just if you're able to modify that, then breastfeeding obviously will be good. And not using hormone therapy for menopausal symptoms would also be protective. All right, so remember I had mentioned something about BRCA gene. It's a gene that is only tested for in people who have a very high family history of different malignancies, of different cancers. So can we go back to that slide? Yeah. So some women actually prophylactically, meaning that before they even have cancer, if they find out that they're BRCA gene positive, they actually have mastectomies. They take off their 2 breasts before they develop cancer. And the very radical surgery is taking off the 2 breasts and taking off the ovaries also, because the ovaries are what really produce the hormones that will predispose you to having cancer. So that is definitely, something that is done very frequently in some people, just a very small population of people. Taking off or having mastectomies in our culture is not people are not really open to it. I actually had, back in Nigeria, I had a patient, I went during my training, who came in with breast cancer. She actually had breast cancer already, but it had not spread. So she was actually at a stage where if she had had the mastectomy, she would have, her survival would have definitely been prolonged. But she felt that taking off her breast will make her less of a woman, so she refused. Also, her husband didn't want her to take off her breast. She eventually, the cancer eventually spread and she passed away. I don't know where her husband is now, but I suspect he's married to someone else. All right. So next slide. So screening, this is very important. Screening is how we find diseases early, even in people who don't have symptoms yet. And it can help find cancers when they are small and achieving a cure if they are quickly diagnosed. Next slide. So what are the things that we would usually, or how do we screen for breast cancer? The first one is doing a self-breast examination. The second one will be a clinical breast examination, and then the last step will be going ahead to get some kind of imaging test to evaluate for breast cancer. So there are different schools of thought. Before we go to the next slide, the American Cancer Society actually is not sure that there's a benefit to doing a self-breast examination monthly, but still, a lot of cancers have been found this way just by doing a routine breast exam, and also some cancers have actually been found by partners of women, just from examining the breast. So how to do a self-breast examination. Next slide. We won't go into a lot of detail, but I do want the women to hear this. So for women who are still having their periods, you want to do this 3 to 5 days after your period, and you want to do it the same day, the same time every month. And for women who are already past menopause, just choose one day of the month and just keep doing it on the same day, because there are hormonal changes that happen throughout the cycle, so that's why you kind of want to pick a specific day to keep doing it. So a self-breast examination, the first step would be to, I hope this is not TMI for some of the men, but it's really important that the women hear this. The first step would be, obviously, you're looking at your breast and you're standing in front of the mirror. You first of all want to look at the skin around the breast, look at the nipple. You know your breast and you know yourself, so it's important that you know yourself and you can identify any changes quickly. The next thing would be lying down. So imagine your breast divided into 4 sections. That's the easiest way that I can explain it. Imagine your breast divided into 4 sections. Using your these 3 fingers. Notice you're not using the tip of the fingers, you're using the flat part of the fingers. Because if you use the tip, you're going to feel bumps. So you want to use the flat part of the finger, and then you go to each of those 4 sections at a time, and then you press and check to see if there are any lumps. You do this again the same day every month, 3 to 5 days after your period is over. You do this test. The slide again. You do this lying down, and you also do it standing up. You do it while you're standing up, you want to press down a little bit on your hips just to tense the muscles behind the breast, and it makes it a little easier to find if there are anything. If you do find anything, the next step would be to go, obviously, to your physician. Next slide. A clinical breast exam is essentially the same thing, but it's just something that is done by a physician. So I thought there was a slide before this, but anyway, so the next step obviously is getting some kind of imaging test to properly look at the breast tissue. And what is most preferred is a mammogram. A mammogram is an X-ray of the breast, essentially. And to do it, the breast is squeezed between 2 flat plates, and pictures are taken, and then you can look at the breast tissue. There are other tests that we can do to evaluate the breasts, depending on, first of all, the age of the woman and exactly what the condition is. But a mammogram is definitely, the best test that we have available. All right, next slide. So what are the screening guidelines for breast cancer that are recommended? It's recommended, this is not a strong recommendation, the initial one, but it's a suggestion that women from the age of 40 to 44 should start doing their mammograms. So you don't have to wait. The prior recommendation was something like age 50, but it's because breast cancer is being identified now at younger ages. It is not yet a strong recommendation, but it is definitely a suggestion. And from the age of 40 to 44, women should get a mammogram every year. From the age of 45 to 54, that is a strong recommendation. Women should definitely get their mammograms every year. From the age of 55 and older, then women can get their mammogram every 2 years. Or if you like, you can continue doing it every year. Now, exactly when do you stop the screening is another question. As long as you believe that you still have 10 good years in front of you, then you should continue your screening. So what that means is that you could have a 70-year-old who is in very poor health, and she has a lot of comorbidities, she has a lot of other things going on, will probably not benefit from continuing breast screening. But there are other, you could have someone who is older, but she's in great health and has at least 10 years more of life expectancy. She should continue breast screening. All right, next slide. So just something for the men. Men do get breast cancer. It's not common, but it does happen. I've seen one man with breast cancer. So it's not just a woman's disease. And approximately 1% of breast cancers in total can be attributed to men, mainly between the ages of 60 and 70. And breast cancers are actually becoming more prominent in men, with a 26% increase from 1975 to 2010. Man's lifetime risk of developing cancer is 1 in 1,000. So it doesn't sound very high, but if you are that 1 in 1,000, then that's very unfortunate. There's, however, no routine screening recommended for men. All right, so can we go back to Sister Nike? The slide with Sister Nike at the beginning. If you've been listening, let's see how much of what we can identify now about Sister Nike. So Sister Nike is 39 years old. Does that make her high risk, or what should she be doing at the age of 39? Or what should she be considering doing? Remember I had said it's recommended that you start your mammograms at age 40. She has two children, and she breastfed them for 4 to 6 months. So that's a plus. She also had her children when she was 28. So that's good. She drinks wine though, but she doesn't drink that much. She does 2 to 3 glasses of wine weekly. So that's neither here nor there. Her mother has a history of breast cancer, so that is not good. Next slide. So she works out, she goes to the gym, she's very active, but she's overweight. So she works out is good, she's overweight is bad. Those are 2 separate things, by the way. Physical activity is one thing, being overweight is another thing. So even though she's overweight, she's working out. So that is good. She's overweight is not good. And she's doing her monthly breast exams. So eventually, Sister Nike went to see her doctor. She was examined. She did have a lump. She had a mammogram, which was inconclusive. This is a made-up story, by the way. There's nobody called Sister Nike. But because of her history of breast cancer, her doctor went ahead and did a biopsy, which came back normal. So Sister Nike does not have breast cancer. Okay, the very last slide. Anything we hear here, I always want to put a disclaimer. Maybe it's the doctor in me. You have to speak with your doctor. You have to follow up with your primary care doctor. You don't go based on advice just from a talk. Any concerns you have to speak with your doctor, address them. There's also a lot of information out there available, especially for breast cancer. I think we all got some informational material. It might not be for us. It might not be, it might just be for a friend, or just someone that you are able to share that information with about breast cancer. If the only thing we can take away from this talk is start your mammograms early, from the age of 40. that will be good. Doing a breast exam is important, and just spreading the word, because we are winning. Actually, with breast cancer, the rates are going down. So I can't remember the statistic, but the number of breast cancer survivors now in the United States is the highest that it's ever been. So it's a disease that we're winning, and we can only promote more awareness. That's only, going to help save more lives. Thank you. I hope.
Today is our Inspiration Sunday, and we have two totally divergent talks. Amen. One has already talked to us about our health, and we're going to have more, not just about breast cancer, about all other things that we should be careful about. But the second talk today is, I gave it a title, it wasn't that's the title, it says Architecture as a Profession. And what that is for, I hope all our teenagers, if they are downstairs, please let them come up. And even for some of us young adults, we can think of changing careers. If you want to become an architect in your middle age, that's fine.
Intuition, creativity, setting standards for life, also bringing knowledge from past generations into more modern living. Architects are not convinced that this is the correct way to go about our lives if we just simply deal with it and say, oh, that's nice, or that's good, or that's pretty. What's behind the scenes? We actually do, as architects, have the ability and the possibility to alter things to fit the way we want to live today. That's why the most important thing we could teach our youth is not to take anything for granted, but to question why we actually have things the way they are, why buildings are the way they are, and why the environment is in the way it is, fashioned, basically. One should also consider that a step-by-step process on how to explain how buildings have evolved in the same way that our own lives show us sort of a growing process. So architecture is about that as well. Buildings evolve as well as humans evolved. So what I'm trying to get at is not only will old buildings still stand and the use of the building was intended for such a purpose, but inside the building, the people that use it also evolve around the building. So the inside workings of the buildings might change. Let's keep going. Questions. Basically, how do we see the world, buildings and spaces, cities in the future? 5 years from now, 10 years from now, or even 50 years from now? That's what inspires architects to create. Is the ability, the possibility, and the desire to foresee, predict, and create our living, breathing, and working world. Successful buildings and spaces are timeless, but still evolve based on the user. The processes of how buildings and spaces are used need the ideas, inspiration, and knowledge of architects and designers. I think that we have to use architecture and design as a way of reinforcing our identity as part of cultural readiness. Your ability to decipher things and to make your way in the global world is vital. We are being bombarded with more and more information on a daily basis. More and more of us are working virtually. We're operating in a world full of so much information, noise, technology, and influence, outside influence, which may be good or bad. That's why it's very important to know where we're coming from and what direction we should be heading in. Architecture and design can tell us a lot about the course of history and the view of people and the world that our buildings and objects have reflected down through the ages. It is a way of interpreting your world that can make you better equipped to cope out there on the global scale, where things are going at full speed. Last page, I promise. It's a lot of information. There are lots of examples in architecture that show how things in the world are connected. Understanding these connections, these connections is why I'm basically here. That's why it's important that children are taught about architecture, because architecture is the unifying factor. There is a function, there are some materials that can be a financial aspect, an ecological aspect, a psychological aspect, even a poetic or cultural aspect. They all come together in architecture. Because architecture is all about the circumstances of our lives, our living conditions, our habits, or comfort zones. The house where we live is a direct result of living conditions in any given place. Whether it's an igloo, a grass hut, a brick and mortar townhouse, or an apartment building, it always reflects the climate in general, basically, not so much the temperature, but the climate of the world we're in. The economic conditions, cultural conditions, technological conditions, each and every one of us has been influenced by that through architecture. And I'm one of those people who believes architecture should be taught at primary school. Traditionally, there has been a tendency to think architecture was a very narrow field, and that's probably everybody's misconception, where they just get behind a drawing board, draw a pretty picture of a house, and hand it off for somebody to build it. There's a lot more to it. Actually, it's far more fundamental than most other subjects. As I've stated, involvement in the arts, sciences, theories, or social aspects are all what makes architecture. Inspiration to create is how we evolved and how the world grows. So one last question is, what is inspiring you? That's all.
Good afternoon. Thank you so much again for inviting my colleagues and myself to be able to talk to you about architecture. When Doshu first mentioned this, I think it was a couple of months ago, he said, you know, I typically don't do anything on Sundays. But he said it was a presentation for a church. And there's 2 times when I do architectural activities. That's if it's at another church or if it's for charitable work. Now, why is that important for me? Because before I'm an architect, I'm also a Christian. So for me, right, keeping God's commandments and keeping the Sabbath is very important. And through architecture, believe it or not, he explained a lot of the technical issues that's involved, the passion that's involved. But through architecture, you are, or at least for myself, I'm able to practice my faith. I'm able to show my faith. You got to remember, architecture, it may sound like a joke, but it might be the second oldest profession there is out there, right? Remember the Levites, right? They were building the temple, tabernacle, disassembling the tabernacle, moving around, build it up again, and taking it down. Those are architects. And one of the famous verses, or the most important verses that I keep as an architect, is from Hebrews chapter 11. Book of Hebrews chapter 11, verse 10. And when Abraham was looking, he was looking for a city whose foundation, the builder or the maker was the architect, was God, right? That's what I believe in. Through architecture, you can practice faith. Through architecture, it's one of the few professions where it has an everlasting effect. If you look at history of architecture, history of communities, how buildings were set up, how societies were set up, you always had a civic building and you had a church. And in between those 2 buildings was a main street. That's why you'll see any state or any country, you'll see a boulevard or a main street. And in that main street, the center of that main street was always a church or a religious building and a governmental building. That is the foundation of society. Through architecture, you are able to evangelize. How? As an architect, just like a doctor, you would not say, I'm going to treat this patient, I'm going to treat that patient, but I'm not going to treat this patient. As an architect, you're able to design buildings, which I have. I was fortunate enough to design buildings for a mosque, for a synagogue, for a Catholic parish, obviously, Presbyterian churches, Protestant churches of all denominations. And that is the benefit. So when I'm, as an architect, when you finish your work and you're able to give service in that completed work, is one of the greatest pleasures that I'm able to get as an architect for this profession. So don't think of it as, making money, which sometimes some people do. Not many architects do, unfortunately. But the benefit, the thankfulness that you get from seeing your product, from going inside your product, utilizing your product, seeing the faces of other people that actually sits there, worship God, and looking at the surroundings and feeling this joy as they're celebrating, as they're giving praise, as they're worshiping. That's what an architect can do. Yes, I'm really commercializing this. I'm trying to emphasize how important architecture is. Believe it or not, there is not that many registered architects compared to other professions. If you look at the number of registered architects that, we keep a tally, across the United States, there's only about 110,000 registered architects. That seems like a lot of numbers. But if you compare that to 1.2 million doctors who are licensed, close to 2 million lawyers, okay, it's not a lot of registered architects out there. It is a profession that is time intensive in terms of studying. You need to know all your sciences. You need to know all your history. You need to know all about economics, business. You need to know the physical sciences. So it is a very intensive, involved study field and profession. But it's one that anybody who has the passion for buildings, who has the passion for structures, for everlasting structures, buildings that are built and designed 2,000 years ago, 3,000 years ago, we can still see, we could go visit. A doctor with, no offense to the doctors, but a doctor that they treated 10 years ago, you may never see again. There's a difference. As an architect, you could create something that could last your lifetime, your children's lifetime, and your grandchildren's lifetime. And that's what keeping the faith is all about, isn't it? When we spread the gospel, we're not looking for that instantaneous gratification of that one person right here and now. We're talking forever, right? So, architect, as being an architect, I'm not gonna, go into too much of architecture because again, this is a Sunday service. It's about faith. It's about being a good steward that God intended all of us to be. And as an architect, you could practice that in reality. Thank you.
Just to round up, the essence is to encourage the young ones to have interest in architecture. You can reach either of us at any time, or any of us at any time, about how to move on if you have children, your brothers, sisters who are interested in the profession of architecture. We tell you the processes involved, and we encourage you about it. And as for ladies, we had in the convention that we had this year, ladies who are interested in architecture will probably be getting free scholarship. The American Institute of Architects is writing a law to make sure all student loans, educational fees that will be incurred by ladies, especially minority ladies, black. The law is written in black and white. It is for black. It's not either whether you are Asian. Doesn't affect Asian ladies. It doesn't affect Spanish ladies, but specifically for black ladies who are interested in architecture, they could get free scholarship. And to buttress Victor's note, 3 years ago, the total number, because he said this year about 110 registered architects in the United States. 3 years ago, there were 89,000 registered architects in the United States. And we have 100,000 registered lawyers in New York State. So the profession of architecture is getting to a risky point whereby students are being encouraged to come into it. Thank you all.
It's an honor just to stand before you with a grateful heart. I need